We are about to get started with today's webinar, our webinar on data quality reporting. So welcome and thank you for taking the time to join us today for this webinar and to learn more about HEALTHELINK's data quality improvement efforts. My name is Jillian Greenbaum. I'm the manager of population health here at HEALTHELINK. And we have several members of the population health team. We have Mary Frank, Melanie Shriver, and Mary Angelo also on the call today that have been working with data contributors at HEALTHELINK over the past several years to improve completeness and accuracy of data that's sent to HEALTHELINK every single day. And just as an FYI, HEALTHELINK has almost 550 unique data sources today. And that's almost 450 physician practices, about 50 long-term care facilities, almost 30 hospitals, 10 regional radiology providers, 7 independent labs, and 6 home healthcare agencies. Just to kind of illustrate how far we've come since our inception in 2009, when we started with only 11 data sources. So our goal today is to briefly touch on both past and current data quality initiatives and to review how it impacts our new population health services. And then we'll take a quick look at how to interpret the new data quality reports that were recently emailed to you. Oops. So moving on, I know that some of you are already familiar with HEALTHELINK's data quality journey, but we thought it'd be helpful to do a quick recap. And going back to 2010, HEALTHELINK was awarded a Beacon grant that ran for 3 years. And the focus of that grant was on improving clinical results for diabetic patients. Over 60 practices provided patient registry data that was used to develop a baseline for patient population and track the impact of various intervention programs over the life of the project. And what was discovered immediately was the wide disparity in quality and completeness of data received by practices, which made the generation of useful metrics very difficult. So HEALTHELINK began formally addressing this issue in 2014 with our Physician Advisory Committee. And the goal was to identify high priority data gaps and work with our data sources to close those gaps in an effort to make measurable difference in the delivery of healthcare services to the populations being served by the Western New York healthcare professionals. And with that, the ultimate wish list was developed, and we began formal efforts to increase the types and number of clinical reports coming into the exchange. And we also began to get a sense of the barriers to our progress. So in 2016, the Data Quality Committee was formed, and by the middle of 2017, HEALTHELINK had begun generating simple data quality reports focused on our hospital data sources. These reports included information on the quality of ADTs that we were receiving because of the impact of bad data on alert notifications. And in addition, we provided information about other types of data gaps, such as whether data sources were providing transcribed reports, such as ED visit reports, EKGs, and other important clinical data. And the response from the community was very positive, and our learnings were great. So in 2018, we generated our first official practice scorecard using the Inspector of Quality Healthcare Data, or IQHD tool, an internal tool at HEALTHELINK that focused on CPC Plus practices and sharing information with entities such as OPA and Evolve Practice Partners to leverage their existing relationships with practices in order to help spread the word about the importance of data quality. And in 2019, it brought the first official request from the Department of Health for a formal written data quality improvement plan for 2020 and the creation of our new population health tool, Healthy Outcomes. And with the creation of that plan and the implications of data quality to our pop health efforts, we realized that data quality needed dedicated staff to manage. And in the spring of 2020, we brought on a full-time data quality manager. So here's a list of the various HealthyLink initiatives that are dependent on data quality, and today's presentation will touch on each of these initiatives. So as you're aware, HealthyLink provides a large variety of services to meet the needs of our community, and they are reliant on these services to support their everyday workflows and other initiatives. Each of these services relies heavily on the accuracy of data within HealthyLink. So starting with patient record lookup, or PRL, is the ability to instantly access a patient's clinical record, which is critical for care management and makes pre-visit planning so much easier for practices. And almost 6 million patient records were reviewed in 2020 alone. Next, moving on to results delivery, which is the receipt of clinical results such as lab and radiology reports directly into a practice's or a healthcare organization's EHR, and enhances the ability for providers to conduct pre-visit planning and reduces duplicate tests. And over 860,000 results are delivered monthly in the Western New York community. CCD uploads. So 10.4 million CCDs in 2020 alone were uploaded. This is patient encounter data that's really the most comprehensive view of a patient's medical information and helps enhance care coordination and provides a more complete data set for population health reporting. Next, alert notifications, which is the receipt of real-time updates regarding patient hospital admissions, discharges, transfers, and ED visits, which has led to improved follow-up care and a reduction in readmissions. Over 10 million alerts were sent last year. And lastly, data repository and analytics, which supports everything from research projects to COVID-19 monitoring, and they all require accurate data within HealthyLink to produce desired results. And next, I'll turn it over to Melanie Shriver to talk more about our Population Health Services program.
Thanks, Jillian. Hi, everybody. My name is Melanie Shriver. I'm the Practice Support Services Team Lead here at HEALTHELINK. In late 2018, HEALTHELINK decided to move into the population health data aggregation space with the support of its board and stakeholders. HEALTHELINK partnered with NextGen to offer a population health tool. This tool supports organizations engaged in value-based reimbursement with a cloud-based user interface that combines clinical data from HEALTHELINK and claims data from regional payers. Practices and providers can use this application called HEALTHOUTCOMES to view common quality metrics, population-based risk scores, and longitudinal patient records that reflect a patient's healthcare across the Western New York community. The data is available at an aggregate level for all patients and at an individual level for consented patients. It is unique in that it's not restricted by hospital system alliances. With a large number of local providers using HEALTHOUTCOMES, data quality improvement opportunities became increasingly visible. Clinical results not being recognized by metrics, miscoded diagnosis, impacting risk scores, and exclusionary criteria are all examples of data quality issues that were uncovered. Some of these issues were discovered by practice users, others by HealthyLink internal staff. Regardless, it offered opportunities to engage in conversation with HealthyLink data suppliers, EMR vendors, and practice staff to address coding. This slide captures the robust data set that currently informs HEALTHOUTCOMES. In focusing more closely on HealthyLink clinical data, this includes more than 430 unique data sources, including 100% of Western New York hospitals, more than 85% of Western New York, approximately 5,300 providers, nearly 100% of all labs, 90% of radiology reports. When we investigate data quality and its impact on population health data, it can be challenging to pinpoint the source due to the sheer volume of existing data sources. We're using this webinar today as an opportunity to introduce these concepts to create a line of communication to HealthyLink's data suppliers in anticipation for future data quality conversations that we need to have with you. The next few slides are to illustrate how all the disparate claims and clinical data sources come together to deliver population health data for practices. This screenshot shows how a practice's patient panels are assigned risk scores based on diagnostic information that is obtained from HEALTHELINK and the regional payers. Foundational to all this is ensuring that HEALTHELINK captures it correctly and that it was sent correctly from data suppliers. This is a snapshot of how quality metrics are displayed in healthy outcomes. We often find a data quality improvement opportunities here when patients are showing up as not meeting a metric, when in fact the patient has either had the service, completed the test, or is meeting the lab value threshold, A1Cs for example. If information in the CCD comes to us in textual format instead of coded, structured data, it isn't recognized by the application and can contribute to overall results of a practice provider's quality score. Lastly, here's an example of a patient record within Healthy Outcomes. The data here, as with other parts of the application, is inclusive of all data suppliers. Imagine here how miscoded vitals could impact this view, or how a miscoded diagnosis could impact the list of problems and diagnosis assigned to this patient. Having a process in place to reach out to data suppliers is critical to practices and providers that are using this data to improve quality and prioritize patients for care management. And with that, I'll turn it over to Mary Frank.
Hi, everybody. I am a senior account manager within the Population Health Department, and I'm sharing information about our NCQA data aggregator validation certification. As you may or may not know, since HEALTHELINK's inception, our mission has always been to deliver the most current and accurate clinical information to where it's needed, when it's needed. Over the years, HEALTHELINK worked with our data sources to make continuous improvements to the completeness and accuracy of the data we receive. HEALTHELINK worked closely with NCQA, and we're excited to say that our HIE is among the first health information exchanges in the entire country to achieve NCQA's data aggregator validation status. We recently completed a 10-month pilot program with NCQA to ensure the integrity of clinical data received from our data sources. HEALTHELINK will now help facilitate the more efficient, automated, and secure exchange of this data in a standardized format from participating providers to local health plans to support their HEDIS quality reporting requirements. The goal is to reduce administrative costs to health plans and practices such as yours for HEDIS data chases, and your practices will have less of a need to react to and support health plan data collection efforts directly in your offices. Among the deliverables noted here, NCQA checked the completeness, accuracy, reliability of data that the aggregators ingest from the EHRs, labs, pharmacies, and other sources, and that aggregators could produce a continuity of care document, or a CCD, in a standardized format that we can pass on to health plans for HEDIS reporting. Of the 50 required use cases that HEALTHELINK submitted to NCQA for validation, all but one EMR successfully met the audit criteria. Next, we'd like to share with you another achievement we're very proud of. In October of 2020, HEALTHELINK was named the Comprehensive Primary Care Plus, or CPC Plus, data aggregator for the Greater Buffalo region by the Centers for Medicare and Medicaid Services, also known as CMS. As you know, CPC Plus is the National Advanced Primary Care Medical Home Model initiative that aims to strengthen primary care through regionally based multi-payer payment reform and care delivery transformation. The Greater Buffalo region is encompassing of Erie and Niagara counties, and it's one of 18 regions nationwide currently participating in CPC Plus. In addition to CMS, this public-private partnership includes 69 primary care practices and support from Highmark Blue Cross Blue Shield of Western New York and Independent Health. Participating CPC Plus practices will utilize HEALTHELINK's population health tool, Healthy Outcomes. This tool, which currently aggregates clinical and claims data, also includes CMS Medicare fee-for-service claims, which will also be used for measure calculations. Having secure access to this data all in one place through Healthy Outcomes will help to inform each CPC Plus practice on not only their treating patients' medical history, but also on utilization patterns and cost of care. The goal is to ultimately improve the delivery of comprehensive primary care and reduce the number of unnecessary services their patients receive. And now I'd like to introduce Mary Angelo.
Good afternoon, everyone. I am a senior account manager as well with HEALTHELINK, working on our population health initiatives. As was mentioned in a few previous slides, HEALTHELINK first developed its initial data quality reports back in 2018. And our focus back then was taking a look at the data that was coming into our exchange on CCDs. Our mission has always been to deliver the most current and accurate clinical information to where it's needed, when it's needed. So in alignment with our mission, we assessed the feedback from practices that we met with back in 2018 and 2019 on our first iteration of data quality reports, along with taking a look at the requirements necessary to achieve both NCQA and CPC Plus certifications. As a result, we recently enhanced our rule set to evaluate data completeness and accuracy with the focus on the key data elements needed to procure NCQA certification and to become a provider of HEDIS standard supplemental data, as well as to continue the support of value-based care programs such as CPC Plus and the Patient-Centered Medical Home, or PCMH. A new data quality report was emailed to you a few weeks ago. It was sent to primary and specialty care practices, long-term care facilities, and hospitals that send us a minimum of 100 CCDs per month. Along with the data quality report, we sent information in the form of a data quality tip sheet, which highlighted the top opportunities to improve the quality of the information your organization sends to us. Before we take a look at sample data quality report, I wanted to briefly touch on the benefits of having high quality, good data sent to us. First of all, as you probably are all well aware, improved patient care coordination is a normal outcome of having access to complete and accurate data, as well as enhancing your current patient relationships when you meet with patients on an initial visit, follow-up visit, or for any chronic conditions. Another thing you can look forward to is having more informed decision-making tools available. This leads to improvements associated with care coordination and the clinical insights to support value-based payment contracts and programs like CPC Plus, MIPS, as well as PCMH. This all leads to less payer chart reviews for various programs like HEDIS, QUAR, and the Medicare STAR programs. So the data quality report that we sent to you recently is comprised of 3 sections. This first section that we're taking a look at here is called a summary section. And basically what it does is it's a roll-up of everything that appeared in the report. So as you could see for this practice, for this particular report, we took a look at 100 CCDs or 100 messages, as they're also known as. In addition, in this high-level roll-up summary, this area takes a look at the lowest score, the average score, and the highest scores of the CCDs that were in the sample. So when I like to explain this, I say, imagine that you're a teacher and you had 100 students in your class. This low score means that 52.50 was the lowest score that someone encountered for the test that they took, so to speak. 94.34 was the highest score of all of the CCDs. And then in the middle is the average of 88.71, which is the average of across all of the 100 messages or CCDs that were evaluated in the sample. The next section of the CCD focuses on practice level reporting. So it took the information that was rolled up in the previous section, and it gives you a more detailed breakdown. So this first bubble says that the report was created after February 25th. We looked at the CCD submitted on or after that date. Each of the next areas is a breakdown by section of the information or the data elements that were evaluated, and it gives you some information such as, of the 100 messages that were analyzed, how many had a procedure codes status section. And in this example, all of the 100 messages had that information, so it had 100% success rate. The next area focuses on smoking status and the codes associated with smoking status. If you take a look under the success rate percent, 100% of the CCDs in the sample had that information present, so there were no errors. And last in this example is the language section. All of the 100 messages had the required information for language. However, 4 of the messages had at least 1 error. And over to the right, there are 2 columns. One is called percentile among peers and one is called rank among peers. These are works in progress right now, and the information that you might see for your practice is really not applicable at this time, but it's like a place setter for a future release. So lastly, the third section of the report goes into further detail for all of the sections that had an error, and it gives you a little bit more detail on what the error was. As you could see, for the first 2 sections, coded procedure status and smoking status code, NA appears throughout that occurrence or the report, excuse me, for that particular section. That means there were no errors encountered, so there is nothing to report on. So the first time we see something is for language. And again, in the previous slide, it showed that there were 4 of the 100 messages or CCDs had an issue with language. What we try to do here is give in like more English-like non-technical terms, what was wrong, what did we find wrong? And sometimes there's 1 error, sometimes there's multiple errors. In this situation, for those 4 messages, the language that was spoken by the patient was not captured. And as you can see in this area here, under the reference document ID, which is blanked out, currently we're able to give you the MRN or the patient ID of the most recent patient when we did that analysis that had that error. So if you were to copy this reference ID and go into HEALTHELINK under the patient record lookup screen, and you plug that value into the patient ID field, you would get right to the patient who had that error or the most recent patient. We're working on enhancements to the tool, and we're looking to bring more iterations of that information in a future release. Next is the coded problems date. There's multiple errors in this situation, and it says that here that a problem concerning time cannot be in the future, and effective times must contain an end date. So basically what that means is whenever you're providing a date to us, it needs to be, not in the future. It needs to capture the date that the problem was discussed, the procedure occurred, the encounter was held, or so forth. And in the situations where a problem is resolved, you need to provide the end date. On this next slide, it's just a quick summary of the data quality tip sheet that we mailed to you along with your data quality report. Basically, the tip sheet contains the latest information on the errors that were encountered for most of the data quality reports that we reviewed internally before we sent them out to you folks. As part of our continuous improvement process, we're looking to enhance future reports to contain additional information and suggestions on how you can improve the completeness and the accuracy of the data that you send to us. In addition, just one more point I wanted to make is the tip sheet could help guide you as well to determine any corrective action that you might need to take from a workflow a standpoint, or with maybe a certain employee in your organization needs to be retrained on a particular topic or issue, or whether or not you need to contact your EMR vendor because it's a vendor issue versus a human error or workflow issue. On this screen, I wanted to give you a couple of examples that tie in the information that you see on the error report to the information that you would see if you brought up that same patient's information in HEALTHELINK via the patient record lookup screen. So as an example, the smoking status date for this example, had 10 occurrences of an error. What the error message or description says is that the smoking status time range needs to have a start and end date. In this example here, the reference ID is blanked out, but again, if you were to copy that reference ID and paste it into the PRL screen under the patient ID, you would get to the most recent patient that encountered that error. So for this particular sample, when we looked at a person who had this error, it turned out that their smoking status was they never smoked. And what happened is they captured it, but it wasn't reported as to the date of that observation. So what was the date during the office visit or the date of that office visit when you had that conversation with a patient? Likewise, if a situation occurred where a person was a smoker, and then the next time you saw them, they said, oh, I quit smoking last month, 6 months ago, you need to capture the end date of the what the patient said as to when they actually stopped smoking. Next example talks about coded immunizations. And in this example, it says there were 4 occurrences, and the error associated with those 4 occurrences is that the immunization administered date is required. If you take a look at the snapshot below of a CCD, the correlating CCD for an immunization section, CPT code 90715 says that they administered an immunization, but they did not capture the date. And this was for a Tdap vaccine. But in order for us to have accurate and complete information, we need to know what that date is so we can share it with you folks who use HEALTHELINK as well as practices who use Healthy Outcomes. Here's just a quick summary of the different sections that we talk about in the data quality tip sheet. I just wanted to summarize some common data quality issues that we have identified when we looked at the majority of reports before issuing them to you. From a social history section standpoint, as I talked about a little earlier, always make sure that a patient's smoking status is discussed during their visit and that the start date is captured. In many EMRs, this date is automatically captured by the EMR system and you don't have to provide it. I believe there was one EMR vendor that we worked with that just didn't have the capability to capture that date. Next is immunizations. All immunizations must have a CVX code that's typically supplied by the vendor, along with the date that a particular immunization was administered. Likewise, if a patient should refuse an immunization for any reason, you must capture the appropriate code or the appropriate explanation for the refusal, and then oftentimes the EMR takes that drop down and converts it to the appropriate code. Next, problem list. Confirm that every problem has a valid ICD-9, 10, or SNOMED code, including the actual date or date range when the patient experienced a problem. Again, oftentimes an EMR will give you a drop-down list of English descriptions, and once you pick the right problem, it translates it into the appropriate code. Next is procedures. For every procedure, please ensure that it contains a valid code, and that would be ICD-9, 10, SNOMED, CPT, or LOIN code, along with the date the procedure was done. And finally, results. Every result that is entered has to have a valid LOIN code and a result date. Again, many EMRs will give you a drop-down. You click on the appropriate result you're reporting on. It will translate it to the appropriate LOIN code, and you would just be responsible for providing the date of the result. Now I'd like to turn it over to Jillian to close out our session today.
So thank you so much for your participation in today's webinar. We are building and expanding our data quality reporting process every single day at HEALTHELINK, and we expect to do some sort of kind of initiative around quality reporting to practices annually. It may look a little bit different next year than it does this year. But after this webinar, we will be providing copies of the presentation and also an FAQ document that kind of captures the common questions that we received across the entire webinar series from participants. And we will send that out as well as a resource for those that attended today. And so with that, that concludes our presentation for today.